Hi, I'm Dr. Robert Moore, and I want to talk with you today about leaky gut. We're not talking about people that have had trauma to their gut, have been exposed to drugs and toxins that have damaged their actual gut. This will apply somewhat, or people that have had accidents, injuries, cancers, surgeries. This doesn't apply to them fully, but it does apply indirectly and somewhat directly. But those would be the main causes for a gut function that's not going to be correctable. We're talking about the people with the gut problems, the leaky gut, and they go to the doctor, and the doctor doesn't understand why. In fact, if you look on WebMD, they'll tell you, we don't really understand why people get leaky gut. Leaky gut, it just seems to be something that we're trying to deal with. I'm going to give you a neurological, physiological explanation as to why people get leaky gut. So I hope that you understand this, and if you would allow us the opportunity to improve upon this by writing comments in below, we'll get started. Now, your gut is in charge of taking your food that you eat and breaking it down to very, very small particles. And those particles are your nutrients. And those nutrients, the very, very tiny ones, they cross from your gut through the gut endothelial cell layer, and they get into your blood. And that's what gives you your nutrients. That's what gives you your energy for you to take and get energy and make hormones and make the stuff that your body makes. Now, it also is a way of getting rid of poisons and getting rid of toxins, because you dump your gut with toxins and it circulates through. As your gut moves through, sends it to the sewer system, and we say bye-bye to those toxins. Your gut also will make some hormones for you. It will make 50% of your dopamine. It will make serotonin for you, cholesterol, other hormones. So your gut has multiple functions. And your gut, you may have heard some people say, your gut is your second brain, or all your emotions have come from your gut. And I want to explain that to you. Now, your gut has about 500,000 plus neurons in it. We call that the enteric nervous system. And that is what communicates to your brain, your main brain, your big brain, big boy brain. And it does so through something called the vagus nerve. Now, the vagus nerve originates in the medulla oblongata of your brainstem, and it goes and it controls, it has a parasympathetic function throughout a lot of organs in your body. But it goes to your gut. And 80% of the function of the vagus nerve is sensory. Its job is to tell your brain what's going on down here, what's going on in your gut. Are you eating food? Are things moving properly? What's the acid level? What is going on? How fast should you move the food? Should you slow down the food movement, the digestion? That's the job of the vagus, to know what's going on. And so your gut will talk to the vagus nerve either directly, right to the vagus nerve, or indirectly through the endothelial cell layer. The vagus nerve will then go up into your brainstem, the medulla oblongata, to something called the nucleus tractus solitarius, which is a sensory input of your brain to sense what's going on inside your body. Because you want to know, how much food do you have in your stomach? Is that food moving through? What's in that food? You also will notice that your heart and your lungs talk to the nucleus tractus solitarius, so you know how fast your heart is beating, the volume of your heartbeat, how quickly you're breathing, the volume of your breath. You want to know what's going on for every situation. This is called the autonomic nervous system. Now, the autonomic nervous system has a dual function. It's to help you survive and help you to thrive. The sympathetic nerve chain is to help you survive. A tiger runs in the room. You see that tiger, your gut function slows down. You don't need to digest your food or sit down and have a hamburger or even go to the bathroom, because the tiger will catch you, and that's the end of you. So you need to shut that down. But you need to get your heart pumping faster, you need to breathe more, and you need to know what's going on so that you respond properly to the tiger. Now, when the tiger leaves the room, it's time to relax and heal. Time to get that gut moving again. Time to digest. Time to go to the bathroom. Time to build up hormones. So that's the autonomic nervous system. And so it's regulated and sensed through the nucleus tractus solitarius. Then an impulse crosses the blood-brain barrier to your thalamus, and it goes to something called the central autonomic network. And this is where your emotions come into play. We've said that your emotions are in your gut. Well, because when you're relaxed, the vagus nerve fires up and you get this tract and it goes to your insular cortex. This is your sense of humanity. This is your social skills. This allows you to sense what's going on in your environment, to see what's happening around you, and to be the blessing that God made you to be that human being. This is where empathy comes from. It will stimulate your hypothalamus, that's your endocrine system, so that you're making the right hormones for the situation that you're in. When you see the tiger, that's a different set of hormones than when the tiger leaves and you're relaxing and you're healing. It'll send an impulse to your hippocampus. This is your memory centers of your brain, because it's very important to remember where the tiger came from and where the tiger left, so that you're always looking for that spot, and you're always looking for that spot over here too. You need to remember what's going on. You need to remember what food you eat. When you eat good, this is where you get, oh, I remember that food. It made me feel really good. I felt good when I ate that food. That's my comfort food, because it fires up this tract. Then there's the ventral medial prefrontal cortex. This is your social. This is who you are socially in the world. And this actually inhibits the amygdala. Your amygdala is part of your brain for panic, fear, and anxiety. Again, the stressor, when you see that tiger, you want your amygdala to work properly. But when you're sitting there and the tiger's gone, you need to calm down your amygdala so that you don't have that panic, fear, and anxiety. Then it sends an impulse to your cerebellum. This is for coordination, cognition. This is a big sensory input to your brain so that you know what's going on and where you're at in space and time. It sends an impulse to your anterior cingulate cortex. This is for an impulse control, so that you just don't go crazy every time you see something or you hear something, or you actually do something when you need to do something. This is the central autonomic network. And the central autonomic network utilizes the vagus nerve, the motor part of the vagus nerve, which is about 20% of the function of the vagus nerve, and that connects to the ileocecal sphincter, right? And through that connects your small intestine to your large intestine and keeps that nice and tight so that the bad bacteria in your large intestine don't leak into your small intestine. If it does, it's going to cause a lot of inflammation, a lot of pain, diarrhea. Oh, sounds familiar, doesn't it? And then also the lower esophageal sphincter. This is where people get heartburn. They get that keeps the stomach acids in your stomach nice and tight, so you don't burp it up. And then the vagus nerve will communicate to the endothelial cell layer to make sure that the permeability is tight, that only small, very tiny particles are getting through. And it will also maintain gut health. Now, what happens in Crohn's disease is a combination of a breakdown of all this stuff. When you have a trauma to your gut, an emotional trauma, a physical trauma, a concussion, I'm just going to ask you this. Have you ever hit your head? Have you ever fallen down, smacked your head? Have you been in a car accident? You ever get your bell rung? If you got your bell rung, that's a trauma to your brain. And what happens is that trauma, now I'm just talking physical trauma, emotional trauma, consistent emotional trauma, death of a loved one, severe stress, that's also just as bad as a concussion. Post-traumatic stress disorder. That trauma stimulates something called microglial cells in your brain. And microglial cells cause inflammation in your brain. And what that does is the microglial cells will blunt the central autonomic network. You don't really know what's going on. And so you don't respond appropriately. And so what will happen is that will blunt the function of the vagus nerve. So we lose permeability. That tight little sphincter of our ileocecal valve allows bacteria to get into our small intestine. And that's very upsetting. That causes a lot of inflammation. Our lower esophageal sphincter doesn't work so good, so we get acid reflux. It's coming through. That's painful. It's irritating. It's painful. It will blunt the communication of cell permeability. So we get, this is the key word, leaky gut. Because now bigger particles are getting through to our bloodstream. The gut endothelial cell layer doesn't work real well, and we're getting actual food particles into our blood. And so we get allergies, food allergies, dairy allergies, stuff that's just not broken down. That's where we get food allergies. That food just makes me sick. And then because the vagus nerve is in charge of the health of the gut, we will get inflammation in the gut. And when we get inflammation of the gut, we aggravate the whole bacterial balance, and something called lipopolysaccharides are made. And those break down the myelination of the vagus nerve. It takes away the protective coating of the vagus nerve, so it slows it down. It blunts the whole function of the vagus nerve. When I say blunt, I mean it just screws it up. And so this is where we get autoimmune disease. We start breaking down our body. Multiple sclerosis. It's not just the vagus nerve, by the way, it's other nerves. And then what happens is the vagus nerve gets messed up, and that will fire up the microglial cells in the brain, and this cycle will keep continuing and continuing. And so a lot of people look at just the gut. Well, what can we do for the gut? What kind of supplements can we take? What kind of medication can we take to cover up the pain? It's not going to ever correct this dysfunction and restore normal function. You have to restore normal function. To do that, you have to look at the gut. You have to look at the brain. You have to look at the integrity of the nervous system, the vagus nerve. You've got to look and see if there's inflammation in the brain. You've got to detox the body. You've got to look at all of those things to really correct the true problem, the whole body problem. There are numerous ways that we can do that. We work with other doctors, other professionals on doing some of the things outside the office. We're going to give you things to do at home. So look for further videos on how we do that. I want to let you know, there's a reason that you have leaky gut. There's a reason that something happened. Whether it be a severe trauma to your gut, cancers, adhesions, something going wrong, this will still have an effect on that. Because that's normal physiology. You may not ever correct the problem if you have a chronic, long-standing damage, but maybe we can improve it, or we can keep it from getting worse. My name is Dr. Robert Moore. I want to thank you for watching this video. Look for further videos on how we separately address these issues and what we can do in our office and outside of the office to help you maintain that complete neurological function of your body, because that's the most important thing. You need to know what's going on with your body. That's one of the most important things that you need to know. A second thing you need to realize is that you need to take active control of your health care. You're in charge, because the third point that I'll always make with people is nobody cares more about your body than you do. So we want to thank you for watching this video. Please subscribe to our YouTube channel. Spread the word. Send this to other people, because this is very important as to why people have emotions and why your emotions affect your gut, why your gut affects your emotions, why you have leaky gut, what's going on inside your body. People need to know this material, so please spread the word and share this video with as many people as you possibly can. We're here to help you. I want to say God bless you. Call our office 810-225-7246 to talk with me directly. And any suggestions that you have to help me make this better, to help me make this more understandable, I would appreciate that. God bless you. Thank you.